as that in the introduction section, each digit of the hand has ability to move freely throughout a full range of motion, basically in flexion and extension. The efficiency and fluidity or forcefulness of such movement is made possible by several pulleys, and this pulley system are comprised of a series of reticular type structures that are either annular, which is ring shaped, or cruciform, which is cross like structure in nature. There are 5 annular pulleys named as A1 to A5 and 3 cruciform pulleys C1 to C3. So here is the figure of a single digit. These are the phalanx, and this is your metacarpal bone. This here named as PA is palmar aponeurosis, and these ring-like structures are your annular pulleys A1, 2, 3. This is 4th and 5th, and the C1, 2 and 3 basically cruciform pulleys are at the phalanx. It forms a hook-like structure. Okay, and the basic muscle responsible for finger flexions are flexor digitorum profundus and flexor digitorum superficialis. Okay, trigger finger is thought to be caused by inflammation and subsequent narrowing of A1 pulley of affected digit, and typically 3rd and 4th digit are affected. This is the A1 pulley. A difference in size between flexor tendon sheath and flexor tendons may lead to abnormalities of gliding mechanism by causing actual abbreviation between two surfaces, resulting in development of progressive inflammation between the tendons and the sheath. Due to the abnormal gliding of flexor sheath and flexor tendon, there won't be any smooth movement, so sudden popping and sudden locking can be a resultant effect. Okay, commonly trigger finger is referred as tenosing tenosynovitis. However, there have been histological studies showing that inflammation occurs more so in tendon sheath rather than the tenosynovium. Tenosynovium are fluid feedback-like structure, right? So most commonly in this trigger finger, the inflammation is happening, and it is happening on the tendon sheath, not on the synovium. So this naming of this disease is little bit incorrect, clashing with the pathology. Okay, what happened in trigger finger is, here you can see this is the normal mechanism of finger flexion. This is A1 2, A3, 4, 5 pulleys, and this must be here somewhere C1, 2, 3 pulleys. Okay, so what happen is, when your muscle will flex the finger, this pulleys A1, A3, 4 and 5th will act as an hook, and it flex and extend the middle phalanx. But what happen in trigger finger is, pulleys will be disturbed and the muscle here won't be able to flex the finger further, and the finger will stuck in flexion or in extension. If you are doing extension and this happen, then you won't be able to flex the finger, and in this picture you won't be able to further flex the finger or extend the finger because of this disturbed pulleys. That happen because of inflamed flexor tendon or flexor sheath. Clinical presentation. Initially, patient may present with painless clicking with movement of digit, then progress to painful clicking and popping. Okay, sometimes finger may have been stuck in either flexion or extension position. Most commonly, finger may stuck in flexion position, and typically affected joint will be metacarpophalangeal joint and proximal interphalangeal joint, and later on stiffness and swelling are there, loss of flexion and extension, palpable painful nodules can be present, or finger lock into, as I said, flexion position. Other signs and symptoms will be thickening at the base of the digit, and pain may be radiate to distal aspect of the finger. Differential diagnosis. Dependent contracture, focal dystonia. Focal dystonia is disease connected to abnormal posture. This is sort of neurological disease. Flexor tendon or sheath tumor, sesamoid bone anomalies, any congenital anomalies, post-traumatic tendon entrapment or metacarpal head entrapment, or metacarpophalangeal joint sprain or Duchenne disease, especially when there is trigger thumb. Then we can rule out the Duchenne disease if there's trigger thumb. Physiotherapy management will be, first of all, patient education about the condition and the importance of daily exercises. Next will be rest, modification of activities, can suggest specialized tool in daily life to ease the pain or to assist the fine movements, modalities, and correction of posture. If there is any contracture of finger, there the finger stretching, and improvement of posture of hand are there. These are the splints for the trigger finger. It can be wear like this. So flexion deformity can be stopped by this kind of splints. Ask if there is any questions and queries.